Hello everyone, this is Dr.Akshata Shanbhag. Today we are going to learn about homeopathic injury remedies. So before we start with the remedies, we will know what are the different types of injuries. So we have abrasion, nerve injury, sprain and strain, burns, fracture, bruises, lacerated wounds, incised wounds, etc. So now we will see each of those injuries, so how they will appear and what are the homeopathic remedies to be given in such conditions. So can you guess which type of injury is this? When you have a fall or so, you find abrasions. So just there will be skin wound where it has been rubbed against something hard and rough. Only the upper layer of the skin will be peeled off. So there we call it as abrasions. So what remedy do you give for abrasions? You have to give calendula. Next we will see what is this? Yes, you guessed it right. It is cut wound. Okay. So or incised wound also we can say, where there is a clean cut. So it is an open wound made with any sharp object. So the remedy used here is calendula, and Staphylococcus aureus is the other remedy. For surgical wounds and all, Staphylococcus aureus is one of the best drug for the healing. Next we will see what is this. What is this type of wound? You don't find here any cuts. So but there is a bluish discoloration, blackish discoloration. So this we call it as bruise or contusion. So when a part of the body is injured and the blood from the damaged capillaries leak out, it forms a red or purplish green mark which is tender on touching. So the remedy here you have to prescribe is arnica. For blunt injuries, for the closed wounds, you have to think of arnica. What is this? Yes, this is burn. So we know burn is a damage to the skin or deeper tissues caused by either burn, either sun, hot fluids, or fire, electricity, or any chemicals. What remedies you will use here for burns? Homeopathic remedies. Cantharis in the first grade you have to use. Calendula is also used for the application. So in burns we have 3 degrees. First degree, second degree and third degree. As we know, in the skin we have layers: dermis, epidermis and subcutaneous tissue. Now with the picture you can see that, so if only the dermis layer is being burnt, then it is a first degree burn. If it is including even the epidermis, mild epidermis also is included, then it is second degree, where you find the blebs present. So then if there is subcutaneous tissue also involved, then we call it as third degree burn. So for first degree we use cantharis, second degree also we use cantharis, and even apis can be used there because blebs will be present. Third degree cantharis and calendula can be used. Now this is, you know this is fracture, bone fractures. So now if a patient comes with a bone fracture, definitely it is a surgical thing, or there may be, you may require the splints and all. So that has to be done for the fractures. Along with that, for the proper union of the fractured bone, so what homeopathic drug you can give? So fracture is a complete or partial break in a bone. So the drug you can use is symphytum and ruta. So what is this? What you can see? The foot is turned to one side and there is a tear in the ligament present. So when there is a tear in the ligament, what do we call? Sprain. So it is a sprain. stretching or tearing of the ligaments, that is the fibrous tissue that connects bones and joints, is called sprains, and the remedies used are Rustox and Ruta for the sprain. Now what is this? You can see that a person is running and you can see in the calf muscles there is a small tear in the muscle. There is a strained muscle tissue. So what do you call this? This is strain. This is called as strain. So we also called as pulled muscle. So we call sometimes people say while running suddenly there is a catch in the calf muscles. There is a pain in the calf muscles. So that is a strain in the muscle, pulled muscle. So when a muscle is stretched too much and it tears, we call it as strain. So what remedies here? Again, Rustox and Ruta can be thought. Now this, looking at this, what you understand? Definitely it is a nerve, neuron. So what happens here? When there is nerve injury. So nerve injury when it occurs. So why nerve injury occurs? Either because of pressure or stretching or cutting. So these may be the causes for the nerve injury. So when there is an acute condition of nerve injury, so what remedies you have to think? Hypericum and Ledampal. These two drugs are for the acute conditions. If because of nerve injury there is paralysis or epilepsy or neuralgia or any other drug, any other symptoms are there, then the remedies may differ. So now here we are discussing only about the acute injury drugs. So we have three stages of nerve injury. So one is neuropraxia, second is axonotmesis, and third is neurotmesis. So as in the picture you can see, when there is neuropraxia, there is just a nerve injury where there is myelin sheath is involved. Myelin sheath is being injured. Okay. So in the second layer you can see, second stage, you can see the axon is being damaged. And in the third stage there will be cut of the nerve. Neuron will be detached from each other. So then we call it as neurotmesis. Now what is this? What you can see in this picture? There is something pricked or something being punctured. So we call it as punctured wound. Okay. So wound made by any pointed object like nail, knife or sharp tooth, etc. So we call it as punctured wound. So when there is a punctured type of wound, so what remedy you have to think in homeopathy? Ledampal is the first remedy you have to give for the punctured wound. So these are the different types of wounds and homeopathic remedies. I hope this is helpful for you in the first aid. Thank you.